Lung cancer remains one of the deadliest diseases globally, accounting for over 150,000 deaths annually in the United States alone. While it can affect anyone, most people who develop lung cancer are diagnosed in the later stages, when the disease has already spread, making treatment more challenging. However, early detection can significantly improve survival rates. By recognizing the warning signs, you can take action before the disease progresses. In this video, we will go through the top 10 early warning signs of lung cancer that you should never ignore. Each of these symptoms may seem subtle at first, but they could be a sign of something more serious. Be sure to watch until the end because we'll discuss a surprising symptom you might not expect. Let's get started. 1. Persistent cough. The lingering warning. A cough that lingers for more than 2 weeks should raise some concern, especially if it doesn't seem to be linked to a cold, flu, or other respiratory infection. While it's normal to have occasional coughing due to irritants or illnesses, a cough that refuses to go away could be one of the earliest signs of lung cancer. Chronic coughs are common in the majority of lung cancer cases. This doesn't necessarily mean that every persistent cough is cancer-related, but if it's accompanied by other symptoms, such as blood in your sputum or chest pain, it's vital to consult a healthcare professional. Keep in mind, even if it's not lung cancer, a persistent cough could indicate another serious condition that warrants investigation. 2. Coughing up blood. Hemoptysis as a signal. Coughing up blood, medically referred to as hemoptysis, can be a very alarming symptom. It occurs when there is bleeding somewhere within your respiratory system, which may be caused by a tumor growing within your lungs or airways. While coughing up blood can also result from less severe conditions, such as bronchitis, pneumonia, or a lung infection, it's never a symptom to ignore. If a tumor ruptures a blood vessel in the lungs, it may lead to this bleeding. Hemoptysis could be minimal, such as streaks of blood in the mucus, or more severe, involving significant amounts of blood. Regardless of the volume, if you experience this symptom, you should see a doctor immediately to determine the underlying cause and receive appropriate treatment. 3. Night sweats. An unexpected indicator. Night sweats, particularly those that leave you drenched and uncomfortable, are often an overlooked symptom of lung cancer. While many people dismiss night sweats as a sign of stress, menopause, or even a hot room, recurrent episodes of waking up soaked in sweat may be a sign that something more serious is going on. In cancer patients, night sweats can occur due to changes in hormone levels as the body fights against the disease. This hormone disruption can lead to sudden and extreme episodes of sweating, especially at night. If you notice that you're sweating excessively without an obvious reason, and particularly if this symptom persists, it's time to seek medical advice. Remember, not every case of night sweats points to cancer, but it's worth investigating. 4. Chest pain. Pressure in the chest. Chest pain is often associated with heart disease, but it's also a common symptom of lung cancer. When tumors grow within the lungs, they may press against nerves, blood vessels, or other structures in the chest, causing discomfort or pain. This pain can be sharp, dull, or persistent, and it may worsen with deep breathing, coughing, or laughing. It's important to note that chest pain can vary in intensity. Sometimes the pain may radiate to the back or shoulders, making it difficult to pinpoint its source. If chest pain is accompanied by other symptoms like shortness of breath, coughing, or fatigue, it could be indicative of lung cancer. If you experience unexplained, prolonged chest pain, especially if it's severe, don't wait. Consult your doctor for further evaluation. 5. Hoarseness. Changes in your voice. Have you noticed that your voice sounds hoarse, raspy, or strained for no apparent reason? A change in your voice can be caused by many benign conditions like laryngitis or allergies, but if it persists for more than 2 weeks, it may be an early warning sign of lung cancer. Lung cancer can affect the voice when tumors press on the nerves that control the vocal cords, causing them to malfunction. While it's rare, hoarseness could be a sign of lung cancer, especially in patients with small cell lung cancer. If your voice has changed and you can't attribute it to a recent cold or infection, it's crucial to have it checked by a healthcare provider. 6. Loss of appetite. A subtle shift cancer, including lung cancer, can cause a reduction in appetite. If you've noticed that you no longer feel hungry as often as you used to, or that you're skipping meals because food just doesn't seem appealing, this could be an early sign of lung cancer. The body's response to cancer can involve the release of certain chemicals that alter how you feel about food, leading to a loss of appetite. Although this may seem like a minor issue at first, over time, it can result in significant weight loss and malnutrition. Since a loss of appetite is common in many cancers, it's important to take note of any unexplained changes in your eating habits. 7. Unexplained weight loss. A major red flag. One of the most common symptoms of many types of cancer is unexplained weight loss. Lung cancer, especially in its more advanced stages, often causes patients to lose weight rapidly without trying. If you've recently lost a significant amount of weight but haven't changed your diet or exercise routine, this could be a serious warning sign. Cancer cells divide quickly and require a lot of energy, essentially stealing nutrients from the rest of your body. This can lead to dramatic, unexplained weight loss. If you're shedding pounds without an obvious cause, it's essential to talk to your doctor and undergo the appropriate tests to rule out serious conditions, including lung cancer. 8. Shortness of breath, dyspnea as a warning. Shortness of breath, or dyspnea, is a symptom that can indicate lung cancer, especially when it appears without exertion. As tumors grow within the lungs, they can block airways or cause fluid to accumulate around the lungs, making it difficult to breathe. Studies show that around 70% of lung cancer patients experience shortness of breath at some point during the disease. If you're finding it hard to breathe, especially when doing normal activities like walking or climbing stairs, it's important to get checked out. This symptom may also be accompanied by other signs like chest pain or a persistent cough. 9. Chronic fatigue, energy levels dropping. Feeling constantly exhausted even after a full night's sleep can be another early sign of lung cancer. Cancer, including lung cancer, often leads to chronic fatigue due to the body's struggle to maintain normal functioning while battling the disease. Fatigue can result from several factors, including the body's reduced oxygen levels, hypoxemia, the effort required to breathe, malnutrition, and weight loss. Unlike normal tiredness, cancer-related fatigue doesn't go away with rest. If you're experiencing persistent fatigue that interferes with your daily life, it's a good idea to see your doctor. 10. Recurrent lung infections, a weakened immune system. Lung cancer can weaken the immune system, making it more difficult for the body to fight off infections. If you find that you're frequently battling respiratory infections like bronchitis or pneumonia, this could be a sign that something more serious is going on. Tumors in the lungs can obstruct airways, causing a buildup of mucus and bacteria, which makes it easier for infections to take hold. If you're suffering from recurrent lung infections that seem resistant to treatment, it's time to speak to your doctor, especially if other symptoms like coughing, shortness of breath, or chest pain are present. Conclusion. Recognizing the early warning signs of lung cancer is critical for early detection and treatment. While many of these symptoms can be caused by other conditions, it's important not to dismiss them. If you're experiencing any of these signs, don't wait, schedule a visit with your doctor. Thank you for watching. If you found this video informative, please give it a thumbs up, subscribe to our channel, and hit the bell icon to stay updated on future content. There are other helpful videos on this channel that you may enjoy as well. Stay healthy, and as always, breathe easy.